Hey everyone, and welcome. Today we're diving into a really important topic: IVF versus natural pregnancy. What are the differences and what are the risks? Let's explore together. So, the big question that's on so many people's minds is an IVF pregnancy really riskier than a natural one? That is a totally valid question, and it's one that's packed with a lot of emotion and uncertainty. Over the next few minutes, we're going to walk through the facts and give you a really clear picture. Here's our game plan. First, we'll look at the risks of the IVF process itself. Then, we'll see how it can affect the course of the pregnancy. After that, we'll touch on the baby's health and genetics. And finally, the most important part, how knowledge and technology can help. Ready? Let's kick things off with part one, the risks of the IVF process itself. Here, we're looking at those very first steps, from ovarian stimulation all the way to the embryo transfer. Okay, let's compare these two processes side by side. On the left, we've got IVF. This involves using medications to simulate multiple eggs, which brings its own specific but managed risks. On the right is a natural cycle, much simpler, where just one egg is released, with no procedural risks at all. So you can see the main difference really is right at the very beginning. One of those specific risks is OHSS, or ovarian hyperstimulation syndrome. It's basically a condition where the ovaries overreact to the fertility meds. Now, I know that sounds concerning, but it's so important to know that doctors monitor this very carefully and manage the risk throughout the entire process. All right, let's move on to our next section, the impact on the pregnancy itself. So once a pregnancy is established, what happens during those 9 months? Studies do show that with IVF pregnancies, there is a slightly elevated risk of certain conditions. We're talking about preterm birth, gestational diabetes, and high blood pressure or preeclampsia. The keyword here is slightly. These are manageable risks with good monitoring. And to help us understand what slightly elevated means, let's look at the numbers. The likelihood of preterm birth with IVF is about 1.5 to 2 times higher. Now, that's a statistic that might worry you at first glance, but let's dig into why that is. Because it's not all about the procedure itself. Often, there are other factors at play. For example, multiple pregnancies, which are more common with IVF. The underlying causes of infertility that led a couple to IVF in the first place. And also maternal age. All of these contribute to the risk. And this is where we get some fantastic news. Modern practices, like transferring just a single embryo, or SE, significantly reduce these risks, especially those linked to multiple pregnancies. Technology is always advancing, making the process safer and safer. Okay, now we're moving on to a sensitive but very important topic, the baby's health and genetics. The question that comes up is, what about birth defects? And here we see a similar statistic for the relative risk. It's about 1.5 to 2 times higher for congenital anomalies. But just like before, this is a number that absolutely requires context. Let's not jump to conclusions before we see the whole picture. And here is that crucial context. This chart shows us the absolute risk. In a natural pregnancy, it's about 1 to 3%. With an IVF pregnancy, it's 2 to 4%. So, even though the relative risk is higher, the actual absolute difference is really small. The vast majority of babies conceived through IVF are born perfectly healthy. And now for my favorite part, where we shift from talking about risks to talking about power and control. Part 4, the power of knowledge, testing, and prevention. This is where we see how technology actually helps us.
Meet PGT, or pre-implantation genetic testing. Simply put, this is a genetic screening of embryos before one is transferred to the uterus. It's an incredible tool for identifying chromosomal abnormalities.
This table perfectly illustrates the unique advantage of IVF. With a natural pregnancy, genetic testing happens after conception. We rely on screenings during the pregnancy. With IVF and PGT, you have the opportunity to check embryos before the pregnancy even begins and select one with the highest potential for healthy development. So how does it work? The process is pretty straightforward. First, a few cells are taken from the embryo. That's the biopsy. Then, those cells are genetically analyzed in the lab. And finally, only a chromosomally healthy embryo is transferred back to the uterus. It's a powerful step toward reducing risk. So, let's sum up the key messages. Yes, IVF carries some slightly elevated risks compared to a natural pregnancy, but the absolute differences in those risks are small. Many of these risks are more connected to the underlying causes of infertility than the procedure itself, and most importantly, Technologies like PGT give us powerful tools to reduce those risks. Of course, it's so important to mention that this entire discussion is for educational purposes only and is not medical advice. For any personal decisions, always consult with your doctor. And if you'd like to learn more about the complete IVF process, you can find all the information you need on the portal ivfforme.com. In the end, knowledge really is power, isn't it?